Hello, everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. Joining us once again is Dr. Rashid Chotani, IEM Medical Director and Infectious Disease Expert. And Doctor, a really important time for us to be talking today. Thank you again for joining us.
Thank you for having me for this very critical issue that is facing the nation, and especially today, which is going to be a very important day for all of us.
Yeah, we're going to talk about the expected approval of the Pfizer vaccine here in the U.S. in just a moment. But first, Doctor, I really want to talk with you about the current situation of coronavirus in the United States. And we're really now starting to see what so many health experts were worried about, and that is that post-Thanksgiving Day surge. It has arrived.
Yes, it has arrived, and it will continue for 2 weeks. Right now in the United States, we've got 15.5 million cases, which is 19% increase compared to the last 7 days, and then 290,000 deaths, which is a 36% increase compared to the last 7 days. We have, everybody's saying that we've got these records. I don't want to say it's a record. I say that this is a public health disaster. We have 3,000 deaths that were reported yesterday, over 3,000 deaths, which is unbelievable. It just keeps on piling. Last week we had 2,855 deaths, and we were saying, my God, that's a lot of deaths. In April, on April 15th, we had 2,752 deaths, but now we've exceeded 3,000 deaths, which is just unbelievable. For the last 5-6 days, we've got over 100,000 people every single day that have been hospitalized. Yesterday we had 106,688 people who were hospitalized, which is a 21% increase over the last 7 days. I mean, this is just incredible and big numbers. We are averaging 2,294 deaths and over 200,000 cases per day if we take a look at 7-day averages. I mean, at this rate, by the end of this weekend, we will top over 16 million cases, maybe more, and then unfortunately over 300,000 Americans will lose their lives. These are just unbelievable numbers, and they're hard for me and for anybody who's probably listening to understand. But all of us need to appreciate the fact that these are, this is real data. This is what's happening, and we've got to be very careful and cautious.
Indeed, we do. And obviously, these numbers that you're talking about are coming at a time when so many of us are getting ready for the Christmas holiday, Hanukkah, and other celebrations this time of year. But, Doctor, we are talking today on what could potentially be a very important day and a game changer in dealing with the pandemic. Let's talk about the expected approval of the Pfizer vaccine. Talk a little bit about what this FDA panel is looking at and what it will be considering today.
So all the data that was available has been publicly published now, and everybody can take a look at what type of side effects happened during the clinical trials. The FDA body is going to be taking a look at all of those numbers very carefully. ACIP has already recommended that the vaccine needs to be administered to healthcare workers and long-term care facility nursing home patients. If we look at that, the long-term facility nursing home patients are about, they're about 3 to 5 million in that particular group, and they have the highest mortality rate. So if we can vaccinate them, then what's going to happen is that we will decrease our hospitalizations, which are, as I said, skyrocketed, and we don't have the capacity. And we'll save a lot of people, and we'll be able to curb the deaths in that population. And then obviously at the same time, we've got to start vaccinating the healthcare workers so they can take care of the sick that are showing up at their hospitals. So that is where we're going to be. But at the same time, CDC, FDA, and all the other bodies are going to be taking a look at, who's going to come after that? Are we going to be, providing the vaccine to essential workers, police officers, and firefighters, and bus drivers, and school teachers, so our kids can go back to school. And then there are other issues that are involved in it, and those issues are, the vaccine has not been tested in children under the age of 16, so we've got to wait because the current studies, the trials, phase 2 and phase 3 trials are enrolling them. So we have to wait to see if, there are any adverse effects in that age group. The vaccine has not been tested in pregnant women or breastfeeding mothers or immunocompromised people, as well as, it's not going to be recommended for people who have severe allergic reactions, specifically if they've had previous allergic reactions to vaccines. So all of those things have to be considered by that body, as well as the data, obviously, which is the most important thing from safety and efficacy perspective. Efficacy, we know they are looking more on safety and the integrity of the data to make a recommendation to the American population that yes, this vaccine is definitely safe. This vaccine is definitely efficacious. Go and get it when it's available for you.
Yeah, and those were important categories that you noted there, that obviously this vaccine, as you mentioned, has not been tested on everyone. So there are going to be some people, some members of the general population who are right now not going to be encouraged to get it once it becomes more widely available. But doctor, getting it to just the first tier of people, there are a lot of logistical challenges when it comes to distributing the vaccine.
Absolutely. And, to be very honest about it, it's very unfortunate that we don't have a federal vaccine distribution plan. And that is something that is desperately needed because everything has to move in a very cohesive fashion from the distribution to the administration of the vaccine to the follow-up of the people that have received the first vaccine and then to give them the second vaccine. It is going to be a nightmare to do that. The folks at Pfizer have actually done a tremendous job in terms of packaging the vaccines in 100 degrees centigrade freeze dried ice, as well as putting in time temperature indicators on them, as well as putting some barcodes that are going to demonstrate which batches they are from. So all of those things and logistics in terms of movement are going to be are not going to be easy, and then we are expecting that this vaccine is going to go to CVS and Walmart and places such as that, so that people can go and get the vaccine. There's a lot of work still needs to be done. And then on top of that, even though what the FDA recommends in terms of the priority group, states still have the prerogative to come up with their own priority list. So there is going to be some mass confusion at the beginning, but I think, there are some very sound people, some mature people who are looking at all of that, and they will definitely come up with some, straight path, which is going to be difficult, but they will come up with something that is going to help us get there. So this is the beginning of the end. This is not the end for anybody that is listening to us. It is just the beginning.
Right. And so, as you mentioned, it will be up to states to distribute the vaccine. How many people, though, doctor, once we start seeing the vaccinations roll out and people actually receiving the shots, how many people do we think will remain vulnerable once that process begins?
So very good question, by the way, very, very important question. And that is a question that needs to be addressed at a much higher level. Also, right now, if Pfizer gets the approval today and Moderna gets the approval in the next 5 or 6 days, we will have, by the end of March, we can vaccinate 75 million people in the United States by the end of March. For herd immunity, we need to vaccinate 200 million people. That still leaves a void of approximately 125 million people. Now let's consider that during that period of time, we have another 10 million people who are infected. So that still leaves you with close to 100 to 110 million people that are going to be vulnerable at the end of March. We know that 3 more vaccines are coming, and they should be out by March, but not before that. So what do we do during that time? Because we are still not developing the herd immunity that we are looking for. We are at the beginning of the end, but we have to get to the end. And during that time, everybody's got to pay they play their part and be diligent in terms of making sure that they're wearing masks and observing social distancing and doing the common sense measures, washing their hands and things like that. Because otherwise, this thing is going to be really a disaster. It is a disaster already. It will be a calamity if we have the same attitude that people had during Thanksgiving, at the time of Christmas, and if we keep congregating and have keep the movement as we've done, this is going to be a huge problem.
Doctor, we are just about out of time, but I wanted to talk with you because, again, at the time of our discussion right now, we're still waiting to find out if the vaccine gets approved. But I just want you, from someone who's been looking at COVID-19 for all of these months, how important of a day is today?
Today is perhaps the most important day for all of us. This is like, how do you compare it? Do you compare it to landing on the moon or something? This is an incredible day. This is just unbelievable, an unbelievable scientific accomplishment. This is an unbelievable accomplishment from the perspective of Operation Warp Speed. And then the scientists that have been working on, you've got to salute those scientists, all the people from all across the world that have participated in this effort. This is monumental. And I can assure you, looking at the data from an outside perspective, what I've been able to see, the data is just incredible. All the people that have all the doubts about vaccines, please, this is a very, very good, efficacious, effective, and safe vaccine to be used. So once it comes out, when I get an opportunity, when my number comes, I'll be the first in line to get it. So get the vaccine when it's your turn, but during that time, make sure that you're observing all the precautions that are needed.
All right, finally, a little bit of hope for us. Dr. Rashid Chotani, always a pleasure. Thank you again for your time this afternoon. Appreciate it.
My pleasure. Thank you so much for having me.